Hello, everybody, and welcome to this conversation that we are going to have with this month's grantee, Brick by Brick Partners. I have several guests with me today. I am Veena Kanke, Director of Grants and Partnerships. I have Amy with me, who is going to be our technical support, and I have two visitors with us. First, we have Dr. Nichintu Eleanor, who is joining us from Uganda. Hello, Eleanor.
Hello, Vina. Hello, Amy.
And we also have Mark Sklar, who's the co founder and the executive director of Brick by Brick Partners, who is proudly joining us from his birthplace, Brooklyn, New York. Hi, Mark.
Hi, Hina. Thank you so much for having us today.
You are absolutely welcome. Now, both our guests are going to share their PowerPoint presentation with us. So, Mark, Eleanor, take it away from us.
Thank you.
Thank you very much. Thank you, Dining for Women, for giving Brick by Brick this opportunity to share what we have. Brick by Brick is a binational partnership between Brick by Brick Partners, which is a US-based nonprofit, and Brick by Brick Uganda, a community-based NGO, which was founded in 2004, mainly to build healthy communities with a mission to improve health, education, and economic opportunity in Uganda.
So we are a organization that builds deep-rooted and lasting partnerships with local government and rural communities to promote sustainable development. We do that through these basic program areas of health, safe water and sanitation, quality education, and promoting economic opportunity. Our programs, our Babies and Mothers Alive program, which is our largest program, is an active partnership with the Ministry of Health and district government to improve the quality of maternal and newborn care at 48 free health centers and hospitals. Our MyPads program is a comprehensive sexual and reproductive health education program for adolescent girls and young women, which has reached over 5,000 girls since its founding in 2012. Our school program rebuilds crumbling free primary schools in our rural communities with the full partnership of those communities, contributing 25% of the costs of the projects. And all of the construction is done by our social enterprise, Brick by Brick Construction Company, which uses an environmentally sustainable technology to rebuild crumbling infrastructure, water and sanitation systems throughout the country of Uganda.
What you're looking at now is the map of Uganda, one of the 54 countries on the continent of Africa. It has 55 languages that are spoken with a population of approximately 36 million. 80% of our population in Uganda is engaged in subsistence agriculture, and our per capita GDP is just $646, and we rank 179 out of 192 countries which are listed by the United Nations. Rakai and Chotera, where you can see the yellow pin, that's where Brick by Brick operates, and it falls way behind the national averages, not only in poverty, but also in maternal and newborn mortality and morbidity and HIV incidence. We have a framework that was developed by the World Health Organization, which is called the 3 delays model. And it mainly explains why women die during pregnancy and childbirth. For us to be able to prevent the deaths and morbidity during this period, we have to address the 3 delays together. So we cannot say we're going to make changes by just addressing the 3rd delay or just the 2nd delay. So we have to address the 3 delays. And the first delay is the delay in decision to seek care, which is mainly at the community level in the families. And we understand that there are socio-economic factors that can determine this. The 2nd delay is delay in accessing care, and this is mainly at the community level, transport issues, infrastructure also. And then the 3rd delay is mainly the delay in receiving care once the woman has been able to reach the health facility. Where you are seeing the green, those are the activities that Babies and Mothers Alive program of Brick by Brick Uganda has been addressing over the past years. And these are activities that we have been able to register great success. The ones in brown are the ones that we have been, these are activities that are ongoing with very minimal support. And I'm excited to say that what you're seeing in red, and that is where the Dining for Women support is going to focus. So Dining for Women will help us address that second delay, which is focusing on supporting the transport network for the women in our communities.
So thank you, Eleanor. So the Mama Rescue Project actually is a really exciting and very, very innovative mobile phone technological application that allows us to link the local boda boda drivers. Boda boda is just a Swahili word for motorcycle taxi drivers, which are ubiquitous throughout sub-Saharan Africa, and automobile taxi drivers, to women in need of transportation in their villages to get from the villages to the health centers. And this application is extremely simple. It does not require smartphones, just a simple mobile phone. And surprisingly, mobile phones are very, very common in our rural communities. And even if women don't have themselves a mobile phone, there is almost no village where there isn't access to a mobile phone that would allow women to connect to this project.
Okay, thank you very much, Mark. Just like you said, that mobile phones are very common in our area and women can access them. So what exactly is Mama Rescue? It's an innovative transport voucher platform and emergency dispatch system which will help mothers in the rural Uganda. It provides transport for the mothers from labor to in labor from their homes to the health center, and also from the health center to the hospital in case an emergency happens and they need emergency transport right to the hospital. The problem is that 7,000 mothers and 45,000 newborns die annually in Uganda. This is a silent tragedy, and most of the causes of maternal deaths are hemorrhage, infection, obstructed labor, hypertensive disorders like preeclampsia that kill these women in labor. Over the past 3 years, through the BAMA program, which takes care of 48 health facilities, 79% of maternal mortality reduction has been registered in our health centers. And the fact that we have only 2 ambulances in our area that serve close to 500,000 people, the drivers of these ambulances don't even stay at the facilities. So when an emergency arrives, you have to call them from wherever they are so that they can be able to come to the hospital, get into the ambulance, and then go and pick the mother wherever she is.
So the exciting part of the Mama Rescue Project is that it leverages local resources and local transportation systems without requiring a major investment of capital in terms of this infrastructure. It also incentivizes the attendance at antenatal care. And we know from our own research that if women attend the 4th antenatal care visit, the chances of them delivering in one of our partnering health centers increases from just over 50% to 81%. And that is the key intervention that saves the lives of mothers and babies, a skilled attendant at every single delivery. The system actually also provides us with an ability to, before the arrival of these women. So in addition to getting women from the villages to the health centers for their deliveries, when women experience life-threatening complications, this system will also work in identifying automobile taxi drivers to bring those women from the health center to hospital. And then those hospitals will receive vital information so that they are prepared to address the needs of these women in a timely fashion. Things like making sure that there is blood available, that the cesarean section room is ready for surgery, that doctors and anesthetists are ready. All of those things will be very, very key interventions to save the lives of mothers and babies.
Okay, thank you very much, Mark. 95% of our women in Rakai and Chochaya live in remote villages, and the distances from the health facility vary between 5 kilometers to around 8 kilometers. More than 10,000 laboring women are in need of transport from the village to the health center, and a number of them, over 1,000, will require emergency referral from the health center to the hospital. With support from Dining for Women, we're going to launch the Mama Rescue in one of our districts, providing life-saving transport to more than 6,000 women who will be in labor. Brick by Brick Uganda, through the BAMA program, we believe that safe motherhood is a human right. And there is absolutely no reason why a woman has to die giving life from a preventable cause. Thank you very much, Dining for Women, for the opportunity. And thank you very much for the support that you have given to us. Right now, we want to hear your feedback and probably answer some questions that you may have for us. Thank you very much.
So, Eleanor and Mark, we'll wait for you to come back to our screen. Thank you so much for this wonderful presentation. I would like to remind all our viewers that the 3 delays that you talk about in this presentation is also discussed in our project fact sheets. So there is a delay in seeking care, there is a delay in accessing care, and there's a delay in receiving care. So Dining for Women is coming in and helping with the accessing care with our grant funding. Eleanor, can you address some of the issues, or what are some of the barriers to seeking care? What is happening on the cultural front in the communities?
Thank you very much, Vina. That's an interesting question because considering the area where we work, there is obviously a lot of concern in the culture. I would want to mention to you, first, I want you to look at we had a slide on the first delay, and we mentioned that there are activities that are already being done through the BAMA program. There's a lot of community mobilization that is happening. We partner with the Ministry of Health, so we work closely with the politicians in the area. We work with religious leaders. We have 105 ambassadors in the community who report to us every delivery, who know where all these women stay. But above all, these people also advocate for the rights of the women. And over the past years, this is something that we have been trying to make sure that it happens. We are trying to create a cultural shift where a woman is seen as someone important in the community, in our society, in the development of our communities. So the fact that naturally they believe that a man should be able to decide whether the woman should go to the hospital, decide whether she has to save. Through the BAMA program, we've been able to educate and make so many advocacies. We also have radio talk shows where we invite politicians to talk and make sure they address issues concerning culture and how this causes deaths. In one of our videos, we have an ambassador who is a man, and this is something important, that these men actually meet, and we have community dialogues with the men in the areas who help us do a lot of advocacy, trying to make sure that they educate the society on the importance of a woman, not always to shun her down, enable her make her own decisions, save money, and be able to work together to reduce these maternal deaths. Thank you.
Oh, absolutely. Thank you so much for this very, very hard work that you're doing to create these cultural shifts so that the entire community is very, very focused on the mother and the baby. And the fact that men and women both are working towards this, whether they are your ambassadors, but we also, and I'm sure our members absolutely love the fact that one of your Boda Boda drivers is a woman. So we hope you will hire more of them. That would be absolutely wonderful. So in the time left, Mark, I wanted to ask you, what exactly are the future plans and where is Brick by Brick Partners moving towards?
Well, thank you so much, Vina. Again, thank you all of the hundreds and hundreds of Dining for Women chapters across the country who are watching this. We're so grateful for your support. So Brick by Brick is working really actively with the National Ministry of Health. So one of the exciting things that's starting to happen is that our model, which is really kind of unique in terms of building these strong partnerships and relying on local resources and building a strong partnership with the district, is starting to become noticed by the national government. And even our ability to track maternal and newborn complications is being accepted by the national government and able to integrate our systems into the overall national plan to improve maternal and newborn health care. We have also some really exciting other partnerships that are, since our model is so much built on not just what we do, but leveraging engaged partnerships with other NGOs that may be doing different things than we do, but kind of create a synergy to improve the health of women and babies. We have exciting partnerships with an Australian-based NGO called Free O2, a foundation which provides an off-the-grid oxygen concentrator. Their goal is to provide oxygen for mothers, babies throughout the world, where that can be an extremely important life-saving intervention. We'll be providing oxygen at one of our 2 district hospitals in the very coming weeks. So that's one thing that we're really excited about. We have another really exciting partnership with a California-based nonprofit called We Care Solar that is allowing us to provide solar-powered light to over 30 maternity centers throughout the Rakai and Chitara districts. Our long-term goal is to take our model and expand it beyond the 2 districts of 500,000 people, and to hopefully improve the quality of maternal and newborn care for the entire region that we're in, that encompasses 5 to 7 districts, obviously with well over 1 million people being served. And that's obviously dependent on how successful we are in finding partners just like Dining for Women to help us improve the quality of care and increase our resources so we can do the most good that we can possibly do.
Absolutely wonderful. I wanted to thank both of you, Eleanor, for joining us all the way from Uganda, Mark for joining us from Brooklyn, and for all the Dining for Women chapters who are watching this recording. Thank you for checking in on us during the summertime, which can be very busy for all of you. I encourage you to watch the grantee video sent to us by our grantee. It is a very powerful video, and thank you all for all the hard work that you are doing.
Well, thank you so much, Veena.
Thank you very much, Veena.